BPPV, benign paroxysmal positional vertigo. This is severe room spinning dizziness with change of head position. So this usually happens laying in bed, you roll to one side, and you suddenly get the spins for about a minute or so, and then it sort of subsides. Pretty common. We don't fully understand it. One of the things that tends to happen is someone opens their fridge, their freezer, then they open the fridge and they forget the freezer's open and they come up, boom, they hit their head and it knocks the crystals loose. You've probably heard of the crystal problem. So what's happening there? Inside your ear, your inner ear, so not related to your hearing, you've got 3 semicircular canals. And this is one of the canals, right? You have a fluid inside the canal. At the bottom of the canal is what's called a cupula that attaches to a nerve that goes to your brain. On the top of the cupula, you have these little crystals that line it, and they anchor these kinecilia and stereocilia, they're hair cells. Okay, so what happens when you turn your head, there is a drag on the hair cells, one way or the other, depending which way you turn your head. Well, it's really a push-pull, it's like this, right? That stimulates the nerve and tells your brain where you are in space with the feedback from both inner ears, okay? What tends to happen is these little crystals from sometimes like head trauma can get knocked loose in the canal and throw the mechanism off. So this is kind of what the inner ear organ looks like, 3 canals. Now here's the thing, it's really easy to fix. All I have to do is basically, if they're floating in here, like this, we position the head in a certain maneuver, get them back down to where they belong, where they get reabsorbed. It usually takes 1 to 2 treatments and a period of not moving your head for 6 hours or so. But what happens is if you Google the exercise for this, there is a bunch of stuff you can do. I usually don't recommend it because here's the issue. The 3 canals share a common space. So what can happen is they can get loose, right? And then you can get the situation where if you don't do it exactly right, now you got crystals loose in multiple canals, and now you have 2 problems. So that's why I don't recommend Googling how to do this on your own. You have to know the exact angles in which you can keep the crystals staying in one canal and going back down to that cupula. That's part 1. Part 2, there's something called a VOR. VOR, vestibular ocular reflex. This is your ability to keep your gaze focused on something as you turn your head. I'm looking at the camera, turn my head side to side, everything looks stable. What happens is that reflex sometimes declines and kind of becomes mismatched because it's the information from both inner ears. And this will usually follow this, depending on the chronicity. So it's kind of, I liken this to having a speedboat and one engine's doing 50 horsepower, the other one's doing 150 horsepower. You're getting a mismatched information and you're going to veer to one side, you're going to feel unsteady. Or if you're driving, everything's going to feel wobbly. So what typically happens, you get this first, and maybe you're dealing with it for months, and you don't move your head, because moving your head is terrifying. And because you don't move your head, the reflex doesn't have to really work that hard. So that becomes miscalibrated. So we put together a program, it's called the Fix Dizziness Yourself program. It basically starts off with 1 to 2 treatments of fixing this first, and then a follow-up program that you do on your own. That usually takes about 1 to 2 months. They're very simple exercises.